Hey guys! So today I have no makeup on and the content obviously is a little bit different. And if you stay with me, I think you will enjoy learning why my face looks like this. Hi, my name is Dr. Jenny Liu. I'm a board-certified dermatologist and welcome back to my YouTube channel. And I recently had laser done on my face. So to be exact, Dual Faxel Laser. So I thought it'd be kind of cool to talk about it, share with you guys my experience, the recovery, and also what I use on my skin. I actually love performing this laser on my patients, so I thought, gosh, why not make a video on it? So if that sounds good to you, I will love it if you can give this video a thumbs up and don't forget to subscribe. Okay, first of all, what is Fraxel? Fraxel is the most widely known brand of fractional laser treatment used for skin resurfacing, a lot of other skin concerns, all the way from like acne scars to fine lines, wrinkles, skin tightening, addressing a lot of these skin texture and skin tone concerns. Now, a lot of people kind of refer to all fractionated laser as Fraxel, but there are actually different types, but because Fraxel is the most common, they're used interchangeably. Just like how we would call like tissue and clinics kind of use that interchangeably. Now, when we say Fraxel, many of us are referring to the non-ablative fractional skin resurfacing treatments. There is an ablative one that we will talk about in a little bit. But how fractionated lasers work, whether it's ablative or non-ablative, is essentially it's using laser light energy and basically creating these narrow zones of microthermal injury. So essentially using the laser to do controlled injury on the skin, but super tiny, where it shouldn't cause scarring. But what it does do is when you create injury, you are stimulating wound healing. So with wound healing, you're getting a lot of like cells, inflammatory cells, cytokines, growth factors, and collagen production. So essentially kind of stimulating the skin, injuring the skin in a controlled fashion, and afterwards basically creating more collagen. So as you can imagine with that, you are improving your skin texture and skin tone depending on the type of laser. So you're improving the texture of your skin, improving fine lines, wrinkles, acne scars, and to a degree offering some skin tightening benefits. So that is all how fractionated lasers work. Now going back to the difference between ablative and non-ablative, Fraxel is again non-ablative, and the difference between the two is that ablative common lasers like for example CO2 laser may ring a bell to you. Ablative basically means that not only does it deliver those narrow zones of injury to the skin, it also in the ablative fashion removes the top layer of the skin with it. Versus non-ablative, it only goes deep into the skin, but your top layer of the stratum corneum still remains intact. So with the ablative laser, you're definitely producing more injury, but also because there is more injury, it correlates with better wound healing. So it delivers essentially what we see is better results. But because it is more invasive, you're missing the top layer of your skin, there's longer downtime and potential higher risk. With any laser treatment, there's always, risk, a higher risk compared to a non-ablative. And also ablative lasers is not really ideal for people that have darker skin tone, because as you can imagine, with the more invasive nature of this ablative laser, you're going to cause hyperpigmentation. So ablative laser usually we don't do on darker skin tone, but somebody who's fair skin, looking for more intense skin tightening, skin rejuvenation results, or even acne scar improvement, ablative offers definitely better outcome, but certainly there's higher risk and higher downtime. So with all of that, usually knowing kind of the difference, every treatment is different depending on this person, their concerns, but Fraxel definitely is a little bit more popular because number one, it's not as invasive and certainly can be used in darker skin tones. And because of the lower downtime, it's just easier to perform. Now, what I had done on my face is what we call the Dual Faxel. Dual means that it comes in two different wavelengths, so the 1550 nanometer as well as the 1927 nanometer. The difference is that depending on the person, their complaints, their concerns, what they're trying to address, you could either just do one wavelength or two. So the 1550 wavelength actually goes deep into the skin to again stimulate collagen. It's really ideal for those who are seeking anti-aging benefits, I really love this wavelength for individuals who are wanting to address and improve their acne scars, so skin texture component. Versus 1920, even though when you look at the wavelength, it's slightly longer than the 1550, but to a degree, when the wavelength is super long, it actually just absorbs water and reflects off of the surface of your skin. So even though 1920 in theory is longer than the 1550, it doesn't get absorbed into your skin. So it actually helps with surface changes of the skin. So for someone that have a lot of like surface sun damage, mottled hyperpigmentation, sunspots, 1920 is really great for that. So again, the Dual Faxel, I love that because it really offers you options. So you can either perform both wavelengths in one treatment setting or just pick one or the other. So like the dual setting is great for anyone seeking kind of skin rejuvenation benefits, wanting to build collagen at the same time improve some of that surface sun damage, or say go with a 1550 for those who are younger but wanting to improve like pores or have acne scars. And then 1927 I think is one that if somebody's kind of wanting to jumpstart on the anti-aging skin rejuvenation, like somebody maybe in their late 30s, early 40s wanting just to remove some of the sun damage, then 1927 would be a great one. Some people even call it like a mini Fraxel treatment where they do less passes with a lighter setting just to kind of give that skin glow, like mini rejuvenation. Now with any treatment, especially when we're talking about building collagen, skin surfacing, resurfacing, textural changes, it's gonna take time. Usually these treatments are done like every month for about 3 to 5 sessions, and then long-term, really 6 months down the road, 3 to 6 months is when you start to see benefits. Unless you're just doing the surface, passes, the collagen building, that really takes time. So I always tell my patients, do the treatment sessions, and then you're really going to see the best results like 6 months down the road, 9 months down the road. It's not going to be very instant gratification. So again, who really can benefit from Fraxel? Really a lot of people. If you're young, have acne scars, it's great for that. You have fine lines and wrinkles and sun damage, it's great for that. I even use it on acne scars to kind of build some collagen on scars that are really thin or stretched out, and have tried it on keloid scars in conjunction with other treatments for hypertrophic and keloid scars. It can also help with the sun damage, pigmentation, some freckles, especially like the 1927, the superficial passes. And for the right person, it could potentially be helpful for melasma. But you really have to be careful with that because depending on the person, heat itself can worsen melasma. So this is where you really want to just talk to your provider, see someone who is experienced. And lastly, something that's off-label, but certainly because you are resurfacing the skin, it can even be used to treat sun damage and precancerous things like actinic keratosis. But because it's cosmetic, often not covered by insurance, I find that many individuals will seek medical treatment for that. It can be used off-label to treat sun damage and thereby improve the risk of skin cancer from occurring. So the benefits from Fraxel is compared to an ablative fractional laser, there's far less downtime. So usually people can go back to work depending on where you work. I mean, I literally messed up, went back to work the next day, but the recovery is about a week or so, 10 days, depending on, how aggressive the laser was performed. And then you will definitely start to see results as that kind of old skin falls off, slough off. Like you are kind of starting to see some of the areas are coming through. It definitely feels so much softer. Now I am about like 4 days after the laser treatment session. So certainly a lot of it is kind of starting to fall off. And then when the skin underneath it definitely feels much smoother and more radiant. And again, when you complete the treatment sessions, 3 to 5 usually is what I tell my patients, then long-term is where you get more bang for your buck, like the collagen building and the skin tightening benefits. And the other thing with Fraxel is that it certainly can be performed in other areas like your neck and chest and can be safe in skin of color. So this is where talk to your provider. Often your provider may even give you things to put on your skin to pre-treat, to prime your skin, and then afterwards using something after the treatment to minimize the risk of hyperpigmentation. But we say that certain lasers you want to be very careful in skin of color, and this is one that certainly in the right hand experienced provider can be safely performed in darker skin tones. Okay, now let's talk about what to expect during your Fraxel treatment. So beforehand, your provider often tell you stop your topical retinoids, your prescription tretinoin, any sort of exfoliants, alpha or beta hydroxy acid about a week before your laser treatment to really optimize your treatment and minimize potential risk irritation. And so you definitely want to stop that. Also, if you have active breakouts or infection, that is also not the best time to perform the lasers. You want to treat those first. Your doctor will probably also talk to you about asking you a history of having cold sores. And if you do have a history of getting cold sores around your mouth, him or her often prescribe you antiviral treatments to either take beforehand or even after the laser treatment to reduce the risk of the outbreaks happening after laser. Now, the day of laser, you will go in, you'll prime your face, so clean your face, wash your face, and then heavy duty numbing cream is applied to your face about 30 minutes up to an hour beforehand. And believe me, you want that numbing cream. Some providers will even do nerve blocks on the face so that way you're comfortable and they can really get in there, like certain parts of the face, like around the eyes. You want to have that because the laser is pretty spicy. So after your face is numb, they'll wash your face and then perform the laser. Now the laser usually is done in 8 passes. So this is where, depending on your concerns, where you're trying to address, you can either do 4 passes of the 2 different wavelengths or 8 passes of one of the wavelength. And so when the laser is on your skin, it is pretty spicy. The best way I can describe it is like having heated pins just running on your skin the whole time. And the forehead I find to be the most uncomfortable for me personally. And this is also the feedback I get from my patients. And I think it's just, we don't have a lot of cushion on our forehead. But yeah, it is pretty spicy. And what happens immediately after is that your face will look red and kind of puffy, and that is very much expected and normal. So essentially immediately after, it looks like you got a really bad sunburn. And after the numbing cream wears off, your skin definitely still kind of will have this mild burning sensation. I mean, the best way I can describe it, I've never had a sunburn in my life, on my face at the very least. It does just basically feel like a bad sunburn. There is going to be some mild discomfort, but not really bad. And you can certainly ice in. That's what we recommend to keep yourself comfortable. But it looks like you had a bad sunburn. And then the next day or two, that redness will fade and that skin will start to turn into kind of this brown color, kind of what you're seeing now on my skin. That kind of is what's left over. And then when you touch your face over the course of the next few days, it will have this rough, gritty sandpaper texture. And then your skin will start to kind of slough from that laser treatment, which is happening kind of around the corners of my mouth. And the skin that's left off underneath it, it reveals kind of this younger, more refreshed, softer, more radiant skin. So that's kind of the whole process. And this whole process will take about, I would say, up to a week to 10 days, depending, like I said, again, the wavelength that was used. Usually the deeper it goes, the longer the recovery, slightly more longer recovery, as well as like how you care for your skin. So let's talk about that, because aftercare is just as important, if not more so, that can determine the outcome of the laser treatment. So depending on your treatment provider, immediately after, they may put on certain things on your skin to help with healing. But the most important is just basically being gentle. You definitely do not want to immediately restart your actives, specifically your exfoliants, and definitely no retinoids until your skin has healed, probably like after a week or so. You definitely want to be very aggressive for some protection. And so this is where I actually even recommend just being inside. You know, certainly you can go out and grab your mail, wear sunscreen, wear a hat, even if you're going to be outside, and definitely wear sunscreen if you're indoors. But yeah, you want to avoid being actively outside. So definitely not the best time to do it like right before a sunny vacation. And the best thing you can do is keep your skin moisturized with gentle fragrance-free thick moisturizer, Aquaphor, Petrolatum, CeraVe ointment, whatever healing ointment you have on hand that your provider recommends is really going to be your skin's best friend. My skin's probably glistening because I have like Aquaphor. I use like CeraVe healing ointment too on my face, and I try to do that like throughout the day if I can, especially at night before I sleep. So if not anything, those are the basics: gentle cleansing, good moisturizer, and basically petrolatum and sunscreen. Now, your provider may ask you to add on additional things that may help to complement, number one, not only complement the laser treatment, but also help to improve outcome, reduce hyperpigmentation, and improve skin healing. And these are things that I usually recommend to my patients, and also what I've been doing on my skin this time around. So let's talk about them. Number one is a good repair serum, and the one that I really love that I actually have used previously with microneedling on myself and recommend to my patients is from Elastin, their regenerating skin nectar. I love this one. Well, first of all, Elastin was really designed to complement procedures like this, but the nectar is great because it's anhydrous, meaning it doesn't contain water, so the texture is like a balm. And what that means is that when your skin is very vulnerable after laser, it already is uncomfortable. Often water-based products can burn and sting, and this one doesn't have water, so it's just really good to use. But also, the technology within this serum helps to boost healing and improve outcome. It contains their tri-hex technology, which is basically a proprietary blend of tri and hexapeptides that's been shown to kind of go in, clean out the dead buildup of collagen, elastin that's damaged from sun exposure, and then stimulate new collagen and elastin stimulate new collagen and elastin forming. Also contains arnica, which helps to reduce swelling and inflammation post-procedure, and then a blend of just wonderful antioxidants to again help to boost skin healing and improve outcome. So that is something that I often will recommend and really have been using myself. Procedure or not, it's great to pair with procedure, but often I'll just use not so much the nectar, but their regenerating serum as like my holy grail peptide serum. It certainly is pricey, not for everyone, but that I just even love using on its own as part of my anti-aging skin rejuvenation routine. Now, this time around, I'm actually trying something different because even though Elastin I love, it's pricey and it's not for everyone. And this time around, I really wanted to try a PR package that was sent to me that was developed by a plastic surgeon, again, meant to be used post-surgery, post-procedure to help with wound healing, skin healing. And it's called Rescue MD DNA Repair Complex. And this is a serum that you can use on face and body that can help to basically improve the outcome of scars after resurfacing procedure, after surgery. And what it contains Lapical, which is basically helps to support natural DNA repair along with peptides and other antioxidants like vitamin E and B5 to again support the skin, soothe the skin, and really not only expedite healing but also improve outcome. Now, texture-wise, it is a creamy yellow serum that when I put on my skin the night of my laser, it definitely did not burn or sting. So just another option. Lastly, another one that I think is a great alternative that is a little bit more easier to find at Sephora, it's actually from Murad, the new cellular hydration line that is a serum and a moisturizer. This actually can be used post-procedure, and I actually have been using their moisturizer and trying that out. I've been using it regularly aside from the procedure, but it can certainly be used post-procedural if you can't get your hands on Elastin or the Rescue MD. Now, ingredient-wise, what it contains biomimetic hexapeptide 9 that helps to reduce inflammation, restore damaged skin barrier, along with refined bilberry seed oil that is just very nourishing on the skin barrier, and then a blend of hyaluronic acid. So it's very creamy, very rich. Again, I probably been, I reincorporated this about day 2 or 3 into it. Did not use it immediately, but certainly I have been using it now, and I think it's just a great complement to post-procedure, and certainly has not caused additional irritation on my skin. So for those, again, another alternative for those who either can't get your hands on or just can't afford Elastin or Rescue MD, I think the Murad cellular hydration is a good alternative. Now, if all of those are out of your budget, you can just go with a good barrier repair cream to help your skin heal. And the two that I recommend is number 1, Avène Cicaphate, and 2, the Roche-Posay Cicaplast. So let's talk about both of them. Number 1 is Avène Cicaphate Restorative Protective Cream, and actually is one that I have been incorporating into my evening routine. It is a little bit heavier, a little bit more heavy duty, thicker compared to the Cicaplast from La Roche-Posay. Now, it is more occlusive, so I personally love that. because if you know me, I love more occlusive, richer things at night, but it really helps to calm and soothe the skin. It has C+ Restore, which is their patented innovation from Avène to help support skin natural barrier. Also have Avène's thermal spring water that it has some soothing benefits, along with copper sulfate and zinc sulfate that both are great in improving skin healing. So this is a great one. It's another multitasker. Honestly, you can use it in lots of different places, right? To soothe damaged skin barrier, to use after minor procedure like this on, baby's butt as a diaper cream. If you have like active diaper rash, you can use it. I actually really love it for the corners of the mouth. For individuals that really get frequent chapped corners of the mouth, this is a great one because it's thick. It doesn't like immediately absorb or like wipe off. So that is a great option. Now, if you're looking for something a little bit lightweight, then go with a La Roche-Posay Cicaplast Balm B5. And actually, I use this in the morning because it just absorbs a little bit nicer and layers a little bit nicely under sunscreen. I've talked about Cicaplast so many times, but I really love it. I really, compared to the Avène Cicaplast, I just think the texture is a little bit more fast absorbing. Even though it's heavy duty and it's multitasking, I really view this two very much similar, and I find they both have a place in somebody's routine, right? It's just personal preference. But this is, even though it's heavy duty, it is not as thick, and so I personally like it in the morning. Layers better under sunscreen. But ingredient wise, it's got La Roche-Posay's thermal spring water, it's got vitamin B5, shea butter, glycerin, derivatives of centella, other antimicrobial, anti-inflammatory ingredients. So I use it very much the same way as Cicaplast from Avène, but this one with its texture, I think for somebody who maybe wants something that's not super heavy or occlusive, maybe prone to acne, this would be maybe a better option for you. And lastly, the one thing that I also incorporate immediately post laser is SkinCeuticals C E Ferulic. So this C E Ferulic serum actually has been shown not only in Fraxel laser studies, but also ablative fractionated laser to pair really well post-procedure. Not only is it well tolerated, but it's been shown in clinical studies to actually expedite healing and improve outcome. So I certainly started that the next day after my laser, and number one, really had minimal discomfort. I think that, with the acidity, it may cause some burning, but certainly did not for me. And I've been using it ever since, like, post day one laser to hopefully improve healing and also reduce any potential risk of hyperpigmentation that laser may bring out on my skin. So that is one that I absolutely highly recommend incorporating into your routine. So going back to the C E Ferulic serum, it's my holy grail. I mean, I don't know how many times I need to talk about this on the channel, but it's got the patented 15% vitamin C along with 1% vitamin E and 0.5% ferulic acid. But what I love most is that it actually has been shown and demonstrated in clinical studies to pair well with not only the Fraxel laser, but also the ablative CO2 laser to, again, improve outcome and healing. So very quickly, what I do now, my routine. So the night of my laser, I actually put on this really nice, not available here in the US, unfortunately, but La Roche-Posay Cicaplast B-Foam mask. It is a mask that actually is great to use post-procedure. I put it in the fridge and then apply on my skin. It was like very calming and soothing. And then that night I put on my Rescue MD repair serum and then my Cicaplast, layered my face heavy with Aquaphor and went to bed. In the morning, I gently cleansed, put on my C E Ferulic, and then the Rescue MD serum again, and then put on Cicaplast, and definitely every morning, absolutely sunscreen. In fact, on some of the days that are super sunny, I have even been popping Helio Care supplements to just offer additional protection, especially with summer being here. And we have more light, and not only UV, but visible light. So I really want to make sure to go with a tinted sunscreen to protect my skin, not only from ultraviolet radiation, but also visible light that can potentially drive hyperpigmentation. And the two sunscreen that I've been playing around that I really been loving this time post laser are both a mineral that I think is just nicer to put on your skin, less irritating compared to chemical. But one is the Isden Erythrophotana Ageless. That's a tinted mineral sunscreen. Love that one because it's also waterproof. So if I need to go outside for some reason, I'm like literally you know, my face is not visible, but I'll put that on. But otherwise, I also have been loving Lion Pose, their Ghostbuster sunscreen. That's tinted mineral. That's very hydrating and lovely as well. So those are the two that I've been using on my skin this time around after the laser. All right, guys, so that is a quick rundown on Fraxel Laser, my experience. And then I definitely will come back later once my skin's completely healed to show you guys the full results. As far as like how many sessions you need, as I mentioned, I typically recommend like at least 3 to 5 sessions about a month or 2 apart to really get the results that you want. Let me know if you enjoyed this type of content. If you want to see me talk more about cosmetic procedures, let me know what you're interested in learning about next. Again, thank you so much for watching. Let me know if you have any questions. I'll talk to you guys next time.